When you get a diagnosis of cancer and then you find out it's in your throat, at least for me, the anxiety meter went way off the scale. You think about consequences such as swallowing, loss of appetite, loss of taste. Further research indicated that robotics clearly was far less invasive and easier recovery. And that, in fact, was the case.
As a head and neck surgeon, I see patients who have cancer in the oral cavity, cancer in the sinuses, in the nose and skull base, as well as in the voice box, pharynx, and oropharynx, which is the most common type of cancer that we're seeing these days.
When I first trained in head and neck surgery, we performed surgery of the oropharynx a conventional way. We'd often have to split the lower jawbone in half and put an incision right down the chin in order to get access to the throat. Nowadays, with the robot, we're able to get in a minimally invasive fashion to work directly through the mouth. And the day of surgery, we avoid the tracheotomy portion of the procedure. And that means that when a patient wakes up from surgery, very likely they're able to speak right away. Later that evening, we could even start them on a diet, primarily liquids.
What robotic surgery allows is excellent magnified vision within the area of surgery within the throat. And surgeon can very precisely remove only that tissue that needs to be removed.
There are a number of different ways to do surgery on somebody with oropharynx cancer in terms of the timing of different parts. We take out the tumor in its entirety, and we also have to sample lymph nodes in the neck through a separate incision. Our preference at Northwestern is to do those two surgeries together. That means going under anesthesia only once and getting all of their surgical procedures at one time.
When I went to see Dr. Samant, that was when I first realized it did not need to be two separate surgeries, and that was a big relief. That was really a game changer.
The benefit of robotic surgery is that you can be extremely precise in the amount of tissue that is disturbed during the course of treatment, such that the swallow is intact, speech is intact, saliva is intact, and so on. And afterwards, even if they have to have radiation, the fact that the radiation now is reduced in dose and is more focused allows the patient to sustain much less normal tissue damage, so that in the long run, they have very few complications.
I went from diagnosis to post-surgery in 45 days and was becoming a cancer survivor. There was no need for downstream chemo or radiation, which is a phenomenal result.
The time frame, looking back, goes quickly, but while I was going through it, it was very scary. But 4 months from diagnosis to surgery and I'm cured, it really is fantastic, and I just can't say enough about the treatment and the care that I received from all the Northwestern professionals.
For oropharynx cancer, robotic surgery has been a game changer because it gives patients the best chance at being cured.